Hi, this is the student design team from University College London. My name is Chen. I'm going to present our design on behalf of my team. This project is about creating a comprehensive platform to improve the experience of vestibular rehabilitation. Let's start with what is the vestibular system. The vestibular system is a sensory system that helps regulate our sense of balance and orientation in space. Its receptors lie in the inner ear next to cochlea. Disorders in this area can result in symptoms such as vertigo, chronic dizziness, nausea, and even hearing loss. But vestibular disorder is not rare in the population. It is estimated that up to 95 million adults across Europe and the US have peripheral vestibular disorders, and it can happen to people across all age groups. Without timely treatment, engaging in even simple tasks can be debilitating for them. So what are some treatments patients can engage in? A commonly adopted one is called vestibular rehabilitation. It is a form of balance retraining therapy that involves engaging in exercises to help the brain adapt to the impaired system, and traditionally it is delivered in person. We want to focus on this rehabilitation process to contribute to the recovery of vestibular disorders. To investigate the challenges and user needs, we did literature reviews first and then conducted semi-structured interviews with 4 vestibular specialists. Following the interviews, we did a bottom-up semantic analysis to identify specific patterns. So we found the following challenges and requirements. The first challenge is the low accessibility of vestibular rehabilitation. Rehabilitation can be a time-consuming process for both the patient and the doctor. Given the high patient demand, it can be hard for doctors to track each patient's rehabilitation progress, and more importantly, the inability to get quick appointments and frequent commuting can put even more strain on patients. The second challenge is the lack of motivation to start or finish a rehabilitation plan. To achieve the best outcome, patients need to engage in rehabilitation exercises many times a day. The training is usually boring and repetitive, so they can affect patients' ability to stay motivated to complete the training. While tackling these challenges, there are some other user requirements that we need to satisfy, including ensuring effectiveness, efficiency, and being patient-friendly. Then it comes to our design process. This includes creating personas, storyboards, and low-fidelity prototypes based on user requirements. And then we conducted usability testing with 8 vestibular specialists to gain feedback from them. And based on the testing feedback, we polished our designs and finalized the 2 digitalized platforms which work in conjunction. A mobile app for patients and a web interface for healthcare providers, including doctors and physicians. We created an interface for healthcare providers because they are very crucial in the process. We want to demonstrate how their involvements can facilitate the digital rehabilitation process, and this is also a current design gap that we would like to fill. To solve the accessibility issue, we made the platform digitalized because through our research, we found many clinicians agree that digital health is a good approach for increasing the accessibility of healthcare services. To ensure the effectiveness of training on the phone, we incorporated the camera, accelerometer, and gyroscope on and inside the phone to monitor patients' eye gaze, head movements, and body movements. More importantly, all training plans are given by the patient's doctor with the help of specialist AI on the doctor's side to ensure that the plan is tailored for each patient. To motivate patients, we redesigned the rehabilitation process to a gamified version. The content is more vivid, and they can collect achievements and badges by keeping up with the training plans. Patients' progress and data summary will be shown on both their and doctor's devices. And lastly, to enhance the communication between patient and doctor on the digital platform, we designed the patient note-leaving function for online appointment booking. By checking the notes before meeting, doctors can quickly get a sense of patient situations and can make the upcoming meetings more efficient. The effectiveness of our design can be reflected by specialists' rating. They commented that this is a plausible design and we achieved our goals. Future directions will be to design a platform that is more age-specific, such as for the elderly, and incorporating mental health-related content is also a good direction. Thank you for listening.